morning, everybody.
Hey, I'm doing great. Thanks. I'm very confused.
My father always said, "Give a good, nice, firm handshake."
I usually do the rheumatoid arthritis handshake where I just touch your hand,
I'm like,
but my brother-in-law yells at me because I don't squeeze. Good point.
but welcome once again, all the conversations by Eddie are purely, and we're back again with our sponsor, got everything. Um, after like the church. What's this? What are you having me looking here?
Hmm. Yes. No. I'm paid not to sing.
Pet cutter, arrow, cat, oh, this good. Like ridiculous. My face. And
Uh,
so we always say have a cool. Tommy's always in. I and what's cool. Always,
mhm.
but lucky for our listeners, if they go to check out in their buggy or cart, if they want to call it, and put in the promo code Buffalo.
It's higher than 10, I'm sure. I'll defer to your expertise.
21%.
Ooh, lucky 21.
Rock on, Dr. Andy.
What would you like to talk about today, Ed?
But when I tell everybody that I'm honest, they thought that was in my turn.
Mm-hmm. Mm-hmm.
Dies the next day. But that has happened.
Mm-hmm. Mm-hmm.
I'll be time prepared for.
Mm-hmm. Sometimes people may retire because they know they have a health problem and they're trying to work to the very end. You don't know until you're that person in that person's position.
Okay, ready for this? My uncle promised
Mm-hmm.
up on top of us. My dad and mom had a double.
Okay.
Maybe get double wide.
I was going to say, mm-hmm. Mm-hmm. Mhm.
Have, have those, they'll have the women underwear with no sleeve. Always had that, no matter what. In Buffalo,
She had
it gets
she had
cold
a wife beater T-shirt, even though she was the wife. She wore the wife beater in that family.
and we possibly always last so
Well, looking at longevity evidence-based, number one factor is going to be genetics. That is a difficult hurdle to overcome. You can't really change it effectively at this time. Things that you want to look at that are evidence-based that you can change. First of all, know your family history. Things tend to recur. Second thing, do get regular medical checkups and treat chronic illnesses like hypertension, diabetes, hyperlipidemia, high cholesterol, and get your screenings done. Pick out the very high mortality bad habits. Number one with a bullet is smoking. Number two, excess alcohol or substance misuse, and minimize them. Next things you look at, what you eat and maintaining a reasonable body weight, because so much baggage comes with having baggage around you.
wait a second. So a shit ton of chicken wings.
It depends if you're the person who sold the man life insurance. How could that have come out?
It's just weird.
Mm-hmm. Mm-hmm. Yeah. Uh, being slender, having a normal blood pressure, not having diabetes, not having high cholesterol, all points in your favor. Having, excuse me, having your cancer screening done on time and not having any of the high mortality bad habits like smoking, drinking, drugs. Uh, some of the more nebulous things that are tougher to put your finger on are life stress. I'm not nebulous. Yes. I stayed at a Holiday Inn overnight last night.
Was it a Holiday Inn Express?
Express.
Oh,
yes.
it's a fancy one. Nice.
Anyway, back back to the ranch. Genetics, screening and treatment of bad habits, screening and treatment of chronic problems, and making sure that you are up to date with your various healthcare milestones. That's where the money is. They've noticed that lower lower calorie diets that are rich in natural foods by natural, grown without additives. Also, whole foods, foods that are not processed. They've noticed some greater longevity. They've noticed greater longevity in people with the Mediterranean diet, but try defining that. There, they don't have solid evidence, but it does look that way pretty much statistically. So a lot of it is just what your mom told you to do. Go to the doctor, treat your blood pressure and diabetes. Don't smoke, don't drink. Change grandparents if you can for genetics. Now, let's ask some specific questions. Please, fire away.
You're going to get upset.
No, why am I going to get upset? What inoculation is that? Okay, no problem with that.
Why? How come when I went to New York,
They changed the recommendations.
oh, okay.
Yeah, now it's 50 if you've got risk factor. No, they've changed recommendations, and the recommendations will continue to change. Things that you want to have on board, you want to make sure that you're measles, mumps, and rubella immune. You want to be varicella and zoster immune. So that'd be chickenpox, shingles. You want to have your pneumonia shot. You want to have your flu shot regularly, and strongly advise continuing to follow COVID and do what's recommended. RSV helps. Now, in terms of screenings, you have to get your cancer screenings done. Colonoscopy of what? Okay, well, you're due again. Mm-hmm, 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 mm-hmm. That does happen. It's not a common occurrence. You're going to hear about bad occurrences. People will, everybody who, when I see them as a patient and I'm a physician and I'll discuss it, everybody has my Aunt Tilly in Minnesota had a perforation and died.
Do you blame me for my
Oh,
apprehension?
I don't blame your apprehension. I would sit down and look at the risk and benefit of it. I would make sure that the colonoscopy knows that that happened before. It's unlikely, it usually is not genetic. So I can understand it. I get it. But there are times where your brain has to tell your heart to take a step back. There are less sensitive, less specific ways they can look via the DNA in the stool test. However, keep in mind, it's like riding a motorcycle. If you're going to ride a motorcycle, have that best helmet you have.
Well,
You're going to have a colonoscopy. So why bother? Sure, go
jumping
for it.
ahead, jumping ahead.
Go for it.
How to be insured.
Well, that's between you and your insurance. And there, if you sit and work with your physician and your colonoscopist, trust me, you can reason with a third party payer. The thing I would recommend would be colonoscopy still is the gold standard because number one, direct visualization. Number two, if there is something small there, they can actually deal with it while you're there. And number three, with colonoscopy, you can have some confidence in a time interval where you can say, I'm going to be okay statistically. Okay, the camera endoscopy is typically going to be used for small bowel. Yes, you swallow it and it goes stomach and then it goes to your small bowel. It's not been really well vetted for the colon. And why look if you can't do something about it? You can't biopsy anything, can't take something out. If you're going to do something to screen for colon cancer, do the best test.
I want to talk about.
Oh, it's quite all right. Mm-hmm. Mm-hmm.
So,
Mm-hmm. Mm-hmm.
holy crap. Here with always.
Yes, I did.
Glass.
Well,
Can you talk a little bit
having,
about
oh,
that?
sure. Okay, sure. Vitamin B12 is vital for neurological function. It's also very important in forming blood cells. If you have a deficiency in vitamin B12, you're going to potentially have neurological problems that, if left untreated with vitamin B12, will become permanent. If you need vitamin B12, you need vitamin B12. Some people will have supplementation by mouth or sublingually that's effective. Some won't. I prefer the gold standard because if you use the medicine, injected, you know it's there, you know it's going to work.
Yeah. No. Yeah. What's missing?
You didn't have the apparatus to inject with, and then you had a little misadventure bending a needle. Those
I am baby Huey. I will
those
break
things,
some.
but those things are all very fixable. Some people will have the injection in the doctor's office if the doctor is willing. Most of the time they are. It is key to have vitamin B12 for your neurological function, for your special senses, for your cognition, and for your motor and sensory function. I wouldn't call them side effects. I call them benefits. I cannot extend what you're having in terms of benefits to imagine magic vision improvement to everybody getting vitamin B12. I'm glad it happened. It's a somewhat atypical response, but hey, if it's good, we'll take it. Uh, the reason I make the face, if you have adequate amounts of vitamins, wonderful. Taking more than you need is not beneficial. The fat soluble ones, A, D, E, and K, you can actually accumulate them and have problems from overdoing it. The water soluble ones, typically you're just having very expensive urine. And you're spending money on something you could better spend your money on. We have so many other demands for our money. Don't overspend for something. Glucosamine chondroitin. It, okay. Glucosamine, pros and cons. Some people will get some joint relief with glucosamine chondroitin. It's mild at best, and with the use of it, it can make your cholesterol profile change significantly for the worse. And if I say knee pain versus possibly accelerating heart disease or blood vessel disease to my brain, I'm going to live with my knee pain thing. Mm-hmm, mm-hmm. Okay, no. Okay. Let's okay. Uh it's individualized. Well, first of all, with testosterone, you have to look at your free, your binding. We won't go into the mechanics of all that. I could babble for a week and nobody would stay awake.
I
But
would.
don't touch me there. Keep your hands to yourself. Anyway, back to testosterone. Somebody may have a little too much over there. Uh, anyway, back to testosterone. If you have a testosterone deficiency with problems related to it, it does pay to replace your testosterone. The problem comes as you age with testosterone, the risks and the benefits begin to kind of meet. Testosterone can do a couple things. Number one, you have to have your blood count always screened on a regular basis because it can make you make too many red blood cells. You say, hey, I've got a high blood count. That's good. No, it makes you more likely to have clots,
Really?
so they have to look for that. Other things that testosterone does in everybody to a certain degree, but some more than others, especially if people are using excessive testosterone. It accelerates the progression of prostate cancer. Some of them, if you have prostate cancer, it accelerates the rate of vascular disease. That would be cardiovascular heart, cerebrovascular lung, duh, cerebrovascular brain.
Know the answer.
Well, the new guidelines, they've taken the initial digital exam away because it has driven so many people away. They do not have an A rated evidence based guideline for prostate cancer screening yet, but it's a discussion you should have with your physician,
Oh, yeah.
and it is a family history dependent disease. If you've got a family history of it, it's important.
What I'm trying to steer you into, Andy, is so what? I don't have a prostate. Who cares? I don't need that, right? What can I do without a prostate?
Okay.
Ultimately.
You're asking what can happen if you have your prostate removed. Okay. When they remove your prostate, they try to do nerve sparing because you have the nerves going through that prostate that also contribute to your ability to be continent and hold your urine and your ability to maintain an erection and have an orgasm. So
Losing it all,
that's
guys.
very,
Losing
very
it all.
important. No, you're not losing it all. They're very cautious. They do nerve sparing procedures, and they will do their utmost to assure you that you're able to have both functions when you finish. They cannot guarantee it. There are no guarantees in life.
One thing that is really and talk about it, say it for
That would be very unusual to be a young guy and need a prostate. That would be pretty improbable. Yeah, they can bank their spermatozoa. That's not a big issue. The bigger issue is why is the man having a prostatectomy? Now they can do partial ones where if it is just because the prostate is limiting the outflow of urine, they can do all sorts of different ways to get at it. But if you do need a prostatectomy, they're going to do their best to spare your nerves and have you maintain continence and have you maintain your ability to have marital relations. You just have to look at why are they doing the surgery.
yes,
Sure.
it might have happened, right?
I've got a friend who told me that um, I wouldn't make butter or cheese with it. I've only ever milked cows and goats. Uh, I think we will reserve some of this for the Saturday night. It, things that can happen with prostatic massage, people can have resultant prostatitis, and you can get septic with it infected.
I'm not gonna get no prostate. What's wrong with
No, I think we need to check his testosterone level again.
you?
Have you had your lithium today? Oh, there's a lithium salt lick out there. Follow the happy deer.
A lot of make the face. I was always taught like that that no matter what type of supplement you take, their body eats, you know,
Well, going back to the vitamins, the fat soluble ones, no, you can hang on to those. You get too much of them. There are kids who will eat a whole lot of tomatoes or carrots. No, actually turn orange
I've
from
heard of
vitamin
that.
A.
That's great.
That's vitamin A retention. That's fairly benign. You take the carrots and oranges away, the body corrects
So,
itself.
so if they were redheads,
Either that or ginger and cinnamon.
I don't like that. So I have a
Yeah,
question.
I think they were maids of honor at your wedding.
So, a man of 58 years old.
Mhm.
Like,
Mhm. You're 58.
besides being love, is there anything that has
Uh, Things that work the best for that are number one, regular exercise with an aerobic component. Number two, good sleep hygiene. Number three, a whole food, clean diet. Number four, looking at the stressors in your life and dealing with stresses.
you stress me out? So you're saying vitamin.
Uh, Hypervitamin taking is not. It does not have any benefit to anything other than the vitamin company is getting. Oh, I've heard of them.
Like, or okay, hot chicken. Yeah.
Country Club was Boy George, and that's a guy.
No kidding. He didn't believe me. Okay.
There's a story there someplace that I don't want to hear. Have you ever heard the song Lola? Oh, we're not even going to go further. So, genetics, getting checked regularly, treating your chronic health problems appropriately, being screened for your cancers, maintaining a medium to low body weight, whole food, varied diet, some evidence for Mediterranean diet, and looking at the stressors in your life. And part of the stress antidote is aerobic exercise and good sleep hygiene. Sure. Physical therapy is magical when done correctly.
That's me.
Mhm, mhm. So you have loner legs.
They told you what it was. Pissing off. It's
Yeah, you had a piriformis muscle contraction. It's a muscle in your glute that will sometimes contract, get short. It can be treated with osteopathic manipulation, treated with physical therapy. It also can be treated in part with non-steroidal anti-inflammatories, and along with the physical therapy, the home exercises and stretching. And walk out of there not in pain and no drugs. Yay!
everything. me and her met. Walked over. But I don't even have need to eat.
Okay, good.
So I guess in my head,
Hmm. It's really
hard to
difficult.
say. Huh?
It's difficult to extend from one thing to another.
Did you see where it's right here? Get that thick? It's my
I think I'm going to go to Apple and have my memory purged. Um,
No ass at all.
yes.
Oh, you're confirming that diagnosis?
I'm just saying
We're not your Andy.
it's quite all right.
Yeah, first couple of shows we had, I'm trying to be respectful.
Oh yeah, I love to kid around. Well, if I pressed it, I think you'd be more offended. I don't think we would do well.
I'm just blown away. Like I said, being a gym rat,
Hey, it works.
those rubber bands. Knock on wood.
From a personal standpoint, I had a car versus bicycle accident, and I had the bicycle that day. 4 neck surgeries, 2 back surgeries, a couple fusions and replacements. Yeah, from the middle of the back to the middle of my shoulders.
Tell them what you do to those poor people like cut your hair, Andy.
My original point was I'm happy, I'm walking and I'm working and working out. No medicines, just stretching and listening to what my physical therapy and my physiatrist told me to do. Now, for the scar, I have a great big scar from mid scalp to mid shoulder blades from having spine surgery done. And when I go to get my hair cut, I'll see a lot of times the ladies or the gentlemen, as the case may be, will lift my hair and they'll start and they'll see this big scar there. And they're afraid, are they going to cut it? Does it hurt? Will it bleed? And I'll see them pause. And they'll say something about, oh, does that scar hurt? And I sit there and say, what? And just watch them.
We're already. Seems like we just started. I hope.
And I wish I was as quick on the draw as you are. You have all the better lines and better teasing, but I will get better. I love it when you tease me. Yes, you are.
I have no ass.
It's also because you can probably kick my ass. Oh, I'm sure you could.
So we're gonna end the show. It's like we're
Mhm.
I always learn from.
I've learned how to duck. Duck, Donald.
But yeah, I'm shocked.
And some of it is true.
What you gotta do, Dr. Andy?
Just keep fighting or hire a surrogate.